All righty, welcome to the town meeting program for Friday, May 29th, and this wonderful coincidence continuing to coincide for us. Great shows with knowledgeable guests just happening to fall on Fridays. I'm always looking for silver linings in the middle of this thing, and we get to visit with two of our local doctors and try to get some perspective on this whole deal with masks. We're going to talk about the availability of our local medical experts to assist businesses trying to reopen who might be concerned as to whether their new plans and their mitigation efforts are the best they can be. Plus, we got to talk about some other frequently asked questions that the doctors are seeing. So that's all on the agenda here, along with the latest information about the reopening of playgrounds, which I will share with you after we do the interview with the doctors. Because actually we speculated on that some before the formal announcement about the reopening of playgrounds plan came out. So like I say, that will be a little easier to reveal to you here after the conversation with the doctors. As always, our town meeting talk show is brought to you by Cordova Wireless Communications. They're the cell phone and wireless provider that brings in all the extra dollars, and then the dollars that you spend with them circulate through our community. Real important in a local economy. Eject that spending from outside the city as much as possible through the various grants and aspects of their business model, that it's millions of dollars a year. I haven't heard the more current numbers, but last time I was able to talk with CTC, which is obviously the companion operation for Cordova Wireless, it was something like $12 million a year that they bring in from outside in different types of federal spending or subsidies or whatever it is. And that all comes to Cordova and circulates through our town. Cordova Wireless has been a sponsor of this show for many, many years, and we really appreciate it, especially in this weirdness that is the pandemic. And actually, before we get to the visit with the doctors, some interesting statewide news yesterday that and it doesn't come as a total surprise. You know, as things reopened, it was expected that there would be more cases of COVID-19, and also as the testing expands, more of the people that are asymptomatic and get discovered just because they happen to have a test, that's going to happen. It's going to be a side effect of more testing. So actually, you know, a jump in numbers is it kind of needs to be in perspective. But still, it's hard to not have a gut reaction when we've had one new case one day and 0 the next day and 2 that day and 4, you know, getting 4 seemed to be kind of a lot. And then in the last sampling period, we hear that they found 13 new cases statewide. 4 of them were in Anchorage, 1 in Juneau, 2 in Homer, 1 in Kenai, 1 in Nikiski, 3 of them elsewhere in the Kenai Peninsula Borough, and 1 in the North Slope Borough. That brings the total Alaska case count to 425, and there were no new non-resident cases. Dr. Zink reacted to this, obviously, you know, because it's a fairly different report. She said, quote, "I know this increase in cases today may come as a surprise to some, but this is why we continue to closely monitor cases and investigate each one. Many of the cases came in late yesterday and are still under investigation, so it's too soon to have details about source of transmission. But other factors, such as increasing in testing, also play a role," end quote. The news release goes on to say the section of epidemiology and public health nursing will be interviewing the patients and following up with anyone who may be a close contact to advise them about their risk of exposure and what measures to take to protect themselves and their community. Zink added, quote, "Alaskans should take this news as an important reminder that the virus is still with us and that we should not ease up on the actions each of us can take to protect ourselves, including keeping 6 feet of distance from others, wearing a face covering when out in public, washing our hands frequently, and cleaning and disinfecting surfaces at home and at work, end quote. And this has been a recurring theme, and you'll hear it too in the conversation with the doctors, which is coming right up here. You know, this idea that the state has moved from this being about what the regulations are, that the regulations are going to keep everybody safe, and shifting that to the individuals and the businesses, you know, the people, quote unquote, to take responsibility for mitigation within our individual communities. And so with that, we will start this conversation. I was fortunate to have yesterday with Dr. Sanders and Dr. Rush about masks, about helping the businesses follow best practices, and some other frequently asked questions. That's the highlight of our town meeting today, visiting with the doctors. And again, after that visit, we'll give you the latest official update on what's happening with the playgrounds. So again, we hope you enjoy this conversation on the town meeting program brought to you by Cordova Wireless Communications. Dr. Sanders, Dr. Rush, very nice to have you both with us here again. Actually, Dr. Rush, since this is your first time with us, tell us a little bit about, you know, your background in Cordova, how you got here, and what your role is.
I'm the medical director at Alanka Community Health Center. I've unbelievably been here about 7.5 years. My husband grew up in Alaska, and I worked in the Glen Allen area right out of residency, and we were kind of looking for an opportunity to get back to Alaska, and have loved being in Cordova since about 2013.
Yeah, well, that's great, and again, I continue to appreciate the fact that we have two different facilities with access to different types of resources, and particularly at a time like this, these crazy pandemic days, to have the two institutions working so closely together, which hopefully sets the stage for being able to continue to do so. Dr. Sanders, the council, the city council, with recommendations from all of you on the medical team, recently upheld the mask rule, particularly in light of the significant loosening of restrictions on the businesses. And masks have been, the use of masks has been kind of an interesting thing as the pandemic has evolved, because, of course, as you well know, we were initially told by a lot of the experts, don't go out and buy them. They won't protect you. And the medical people need them. And then there was this shift, I forget if it was in April or whenever it was, to all of a sudden they are a good idea and everybody should wear them. And in fact, they're mandated in certain communities. And it seems that that's been sort of confusing to folks who haven't had the time necessarily to follow all of the nuances of it. So could you explain that, you know, you being a Cordovan doctor, explain it to our people and kind of how this has evolved from your perspective.
Well, in the beginning with this pandemic, very early, just like very early, we all ran out of toilet paper. The medical community ran out of the personal protective equipment. So gowns, gloves, and masks were in very short supply, and we just did not have enough to be able to provide them to all of the staff that were actively seeing patients that had coronavirus. So in order to protect that supply, the information coming out from CDC was, please don't get masks. Masks won't help you. Please save those masks for healthcare providers and medical and first responders. Over time, as we learned more about the illness and as the situation evolved, the messaging became very strong that we do want the public wearing cloth face coverings. The cloth face coverings certainly don't prevent quite as much of the small particulate matter as a surgical mask, and not as much as an N95 does. but they do help significantly reduce the amount of respiratory material that's coming out of a person's mouth by about 50%. So as we've learned more about how this disease is transmitted, we're seeing that the direct contact and the aerosolized particles that are coming from people's mouths are probably the primary way that the disease is transmitted. We're seeing very small numbers of transmission coming from contacting high-touch surfaces even. So the guidelines around the masks are very, very important. This is the primary mode of transmission, is coming from people's respiratory droplets.
And that's not something that a lot of the experts necessarily knew early on, not because they don't understand viruses and the transmission of germs and that kind of thing, but in large part because there wasn't as refined an understanding of this particular virus. Would that be fair?
Absolutely. There are some viruses are more transmitted more readily through contact. Some viruses are transmitted through the airborne, and some viruses are transmitted by what we call droplets, which are just the larger particles. So it takes time to learn with every virus or any infection, the primary mode of transmission. We're still learning about this.
Yeah, it very much seems to be when you're dealing with something that's new, you can rely to some extent on what you've learned in the past and experienced with other situations, but each one of these things seems to be a little different. Dr. Rush, anything to add to that, the sort of evolution of thinking about masks?
That was a great summary, only that the more they learn about COVID-19, there seems to be a combination of the amount of particles you're exposed to or droplets, plus the amount of time you're around someone who may be carrying the virus. So when you look at those two things, the thing that most readily transmits is obviously being in close proximity, even with people talking in normal voices, you're releasing so many particles of the virus. So if you're in close contact with somebody without a mask on, they're asymptomatic, so they don't know they're carrying the virus, and you're sitting across from them at a table over, say, a 30-minute to an hour amount of time, you're getting re-exposed again and again to so many particles in the air. That's why wearing a mask for the person who may have the virus and the person who doesn't have the virus is going to be extremely beneficial as we move forward toward reopening.
Okay. So again, this idea that my mask doesn't necessarily protect me, but it does have a significant impact on me protecting you, particularly if I'm an asymptomatic carrier. That still holds?
It does hold, yes, but I believe it protects both to some degree.
Yeah, just not to the extent, for the wearer, but certainly in spreading it around. So, Dr. Sanders, back to you. There were some questions. I forget if it was from counsel or somebody that called in, but some, how to use these masks properly, particularly lay people who are not doctors, not nurses, don't deal with them all the time. You certainly don't want to make things worse for yourself or somebody in your household by mishandling a mask. So what kind of guidance would you give as far as best practices for these?
So for best practices, the guidelines are really wash your mask every day. This can be done by hand washing, using the 5 tablespoons of household bleach in a gallon of water. It can be done by using a washing machine, or you can hand wash or use a washing machine and then put it through the dryer, and that hot cycle in the dryer also helps to dry it. On the sunny days here in Cordova, when we get them, the sun is also a fantastic way to dry it, because the UV will also help sterilize the mask.
Okay, and then as far as maybe Dr. Rush to you, as far as the taking it off and putting it on, there was a lot of concern that if you're having to fiddle with your mask, that you're creating problems. I know that the CDC has revised its its concern over surfaces, not eliminating whether it can be transmitted on surfaces, but that was minimized. So what about people that are worried about, how often they may have to touch it to put it on and take it off?
The bottom line is, when you look at the science, wearing a mask is safer than not wearing a mask. And even if you're a little careless with your mask, it's still much more protective than if you were being exposed or being an exposer in a social setting. So simply put, they're finding out more and more that those fears are unfounded. Certainly it is better to be careful about taking off the mask, not touching the outside surface and then touching your eyes. But both the fact that contact is seeming to be less and less, contact of surface is less and less of an issue, and respiratory really does seem to be more of the way of transmission. Certainly that the scientific evidence supports that masks are much more beneficial and will be much more beneficial going forward than not wearing a mask.
Okay, and Dr. Sanders, didn't I actually hear you respond to a question about, somebody just asked at council flat out, if you're wearing a dirty mask, are you making things worse or are you making things better? And when it comes to the egress side of things, what you are putting out and possibly infecting other people, your answer to that was interesting. What was your opinion?
Yeah, so one of the things when you're wearing a mask is those respiratory droplets, as they're coming out of your mouth, they're large, and that's as they're first coming out from your face, it's as large as they're going to be, so they're going to be more easily captured in cloth face covering or mask. And then as those droplets get out into the air, the water evaporates off them very quickly, and it will leave the larger particles remain suspended in the air for longer. If we're able to capture those in the mask while they're still larger, then they don't ever get out into the air and around people. So that's part of that. That kind of goes in line with that. My mask protects you. Your mask protects me. Because as those particles get smaller, they certainly can more easily fit through the fabric mesh on the other person's mask.
Sure.
Which kind of speaks to this idea of the viral load. We knew that there's some component of this that increased exposure increases your risk. So just to kind of add to what Dr. Resch was saying about the best practices of touching your face and adjusting your mask, in the household common settings out in town, grocery stores, the viral loads are going to be very low. It's pretty unlikely that people are contacting a surface and then adjusting their mask and end up really introducing a large amount of virus. Now, you will see guidance, and you'll probably hear nurses and doctors, whether it's online or even around, say, oh, you shouldn't touch your mask. I am really trying to educate my nurses at the hospital. They're working in a potentially dangerous area with a much higher potential for having a high viral load. Their practice is to not touch their mask, to not be touching the surface and then touch their mask without doing hand hygiene first. So if you're in a center that has very high viral load, that guidance does change, and we're a little bit more cautious with how we touch and adjust our mask.
Sure, and this viral load thing is interesting. Again, another part of the learning process, it seems, for everybody in terms of how this new, that's why they call it a novel coronavirus. It's new. It's not something that, maybe other forms of coronavirus have been encountered, but not this one. And so, everybody's, it's funny, I heard a really good analogy that it's like trying to build an airplane while you're flying it. So, the fact that sometimes guidance changes, is that, when you hear that, Dr. Sanders, does it make your head hurt, or do you think, no, okay, well, people are doing their job, they're learning, and they're adjusting guidance based on what they learn?
I imagine Dr. Rush feels the same. As physicians, we're pretty used to adjusting guidance. We have follow science with things all the time, including how we address people's blood pressures, and sometimes those goals change, and that's something that we've been managing for decades, and yet still we'll get new scientific information that will come out, and then we change our target. COVID has more research going into it right now than any infectious disease has ever had in such a rapid amount of time, so it's not surprising that we're going to be getting these changes to our understanding of the illness coming kind of rapidly. So I think in medicine we're used to adapting to those things. The other thing we're used to is treating respiratory illnesses. This is a major part of what we do. Sometimes we have illnesses that we don't have a direct treatment for, and we just have supportive care. So that part isn't new. In healthcare, using masks to protect ourselves is common practice.
Yeah.
So I think that there, like you brought up, there was some concern in the beginning of the availability of masks, and so the messaging was kind of confusing, and just like it took Cordova some time to get organized in our response, it took the federal government time to get organized in their response as well, and understand this and get the correct messaging out.
Dr. Rush, go ahead and jump in here too. The idea that guidelines change, does it give you heartburn, or is that like, well, yeah, that's just the way it is?
Maybe a little bit of both. Just because you're working really hard to stay abreast of the latest research. You're really putting time into making sure you know what the latest guidelines are. And at times you feel like, okay, you're recommending one thing and then it seems to change. But I just echo Dr. Sanders in saying that that is a part of science, that is a part of medicine, and it's not that unexpected. This is just everything we normally do basically on steroids because it's happened so fast, and everyone, obviously all eyes are on this virus and what has the evolution of it.
Yeah. Well, and of course you also have this sort of stigma where the general public expect doctors to have all the answers all the time and to never be learning and never be wrong, and that you should have had this all figured out 5 months after there was an announcement of a pandemic, which, of course is not an entirely, I suppose from a psychological standpoint, not an entirely unreasonable position if somebody is scared, and doctors are the ones that presumably are in the best position to shield somebody from the worst potential outcomes. But there's I think the point that you both made is really interesting, that in medicine there's constant education and constant evolution of thought going on, and the fact that the epidemic is so public and moving so quickly, it may make a lot of us out in the general public make our heads spin, but to those of you in the profession, while it may be frustrating to have to change the guidance that you're giving, that it's clearly not something that's unexpected, and I really appreciate that perspective. All right, so let's move on now to something different. Again, that I heard in the council meeting that fascinated me, and again, just Cordova being awesome, where maybe other communities can't be as awesome or don't choose to be as awesome. But this idea that the both of you, and I would, I don't know if it would just be you two or others of the doctors that you work with or supervise, are willing to make time for businesses that are looking to reopen but really want to do it right, that you are willing to interact with them and possibly do a walkthrough or at least a phone call. In other words, you want these folks to feel free to get in touch with you to do that. And Dr. Sanders, since I heard you mention it at council, why don't you take that first? What's your vision for that?
Yeah, so this is something that we offered to the processors early on and have done some of, and will continue to do for any of the businesses in town, is offer to go in and do a walkthrough and see if we can identify places that could be high infection transmission risk. As physicians, we're used to looking at our own clinics and hospitals and doing the environmental walkarounds where we look and see where our weaknesses are and try to help protect our staff and the patient. So sometimes we have a little bit of a different eye for seeing places that could be potential danger that maybe other people don't see, even though we're all reading the same guidelines. Sometimes it's nice to just have an extra set of eyes, so we're available if people would like to take us up on that. And it would be a combination of maybe one of the physicians and a nurse, or we have several people that have offered to go and participate in these if there's a need.
Okay, and Dr. Rush, I assume you're equally eager to be able to do that for folks, for businesses or organizations?
Yes, absolutely. This actually really excites me in terms of being able to continue to do things right. You were right, JR, in saying that Cordova has been awesome in their response across the board. And this is a really crucial time. I want to make sure businesses know we're not wanting to go in to criticize or tell them how to do things or look for, ways to shut them down. Of course not. We're looking at making things really great for reopening, and we're willing to do anything to be able to help.
Yeah, well, and you raise the point about the processors being as proactive as they were. Obviously led to the success in isolating that one case. As I recall, that has been working with out-of-state workers in some of the other communities. I don't think at this point we've had one of those out-of-state workers create a hot spot in the other fishing communities. My information could be out of date, but it does seem to work. And in fact, Mayor Copeland was talking about that too. He mentioned the fact that this process, this proactive process, has worked in the fishing industry, in the processors, which are analogous to meatpacking plants, which have had big old outbreaks in the lower 48 that hopefully they're getting under control. I mean, it's true that potential would exist in the absence of extensive testing and good quarantining and so forth. And it seems to be working. So the idea that the businesses, the individual businesses would sort of do the same thing, and as they develop their plans, to feel free to consult with you enables those businesses to potentially have the same success. And I suppose it goes without saying, Dr. Sanders, but again, nobody should think that you walking in there is them setting themselves up for being called out for something or that they're doing something wrong that's going to be discovered and get them in trouble, right? That's totally not what it's about.
Oh, absolutely not. I'm a physician, and the nurses that we would have going with us, that's their skill set is nursing. We don't know anything about running grocery stores or restaurants or fish processing. Our only goal is to try to identify things that maybe they've overlooked from an infection control standpoint, because that's what we do in our facility all the time.
Dr. Rush, what would you envision some of the things, say you were going into a restaurant, some of the things that you would look at to try to help provide guidance on? Or is it possible to speculate because it would be so individual depending on the facility?
Well, you mentioned the meat packing plant. There's several things that have been identified as what they call super spreaders in the lower 48 when the virus really took off. And all of those had one thing in common. It's they're, a group of people, 10, 15, 20 people were gathered together over an extended period of time. That, again, is the equation of viral load plus time, exposure time, equals a greater chance of catching the virus. So, honestly, just looking at what would be a way that they could set up their space that would still be optimal for socialization, but have maybe safe distancing between the tables, to look at if there's any outdoor opportunities for seating, as the greatest degree, the best place to be if you're going to be socializing is outside, or just any other things. They had an interesting study about airflow in one restaurant where, there were air conditioners that would go from the left to the right side of the room. And everyone in that row got sick to a differing degree. But the tables that were right adjacent to that, no one got sick. So looking at those things that we kind of know from the research could be helpful for a safe reopening.
Yeah. Well, and again, building on the knowledge that's gained along the way, certainly. As we, that's kind of moves through the things that I was curious about. Do either of you, and maybe Dr. Rush will start with you, on whether it's masks or whether it's walkthroughs of the business or just Cordova's response in general, are there any sort of frequently asked questions that you get kind of a lot that you think, boy, I wish I could answer this question in front of a lot of people all at once? What do you have any of those?
Right off the bat, we already answered the one that people are seeming to ask, like, are masks beneficial? And yes, for sure they are. The only exception to that is if you're outside hiking in the open air, that's a time where you don't necessarily need to wear your mask if you're practicing your social distancing. That seems to be the hot spot. What do you think, Dr. Sanders?
Yeah, I was going to say same question. It's what's one of those things that we could that you could really benefit a lot of people at once that you get asked a whole lot.
I think there's a lot of concern with what to do with the parks. Kids are having a hard time going by and seeing the parks they want to play. I think that one of the things that I have a lot of confidence in being able to say we can probably reopen parks safely is that we haven't seen a park be the identified spot of a cluster. It is outside. The sun provides a lot of sanitation for us, especially on sunny days when we have sun out. So I think if we have families being cautious with teaching their kids to social distance, and sometimes when the kids can, wearing a mask and keeping them away from other kids, but allowing them to play in parks is probably going to be something that we can safely do with parents really being aggressive to identify and mitigate the risk for their own families. There's been some talk of how do we get sanitizer out in public facilities. I think that's going to be a really hard thing to do. We don't think we can have sanitizer outside in the heat. It just won't remain as effective. So we're going to have families really bring their own tools to keep their families safe and their children safe.
Okay. And as I had a news release on Thursday that we put out in the briefing that said they're hoping to have June 1st be a target date for the playgrounds. So, that can always change. We always have to, any date or plan is always subject to the whims of 2020.
And part of that is that hand sanitation, trying to figure out how we can, because families don't have access to hand sanitizer, right? It's really hard to get your hands on hand sanitizer right now. So how do we make sure that there's adequate spaces for kids and adults to wash their hands at these public facilities? So thank you for preferencing that, because I'm not trying to get people out to the parks prematurely.
Right.
We are working on that problem, and we are hopeful to get kids out into parks as soon as we can do it.
Well, and people will need to understand, and this was highlighted in the briefing, that it is going to be an at-your-own risk. It would be like using a swimming pool when there's no lifeguard. So everybody needs to understand that going into it, that with the presence of the virus, there is some more risk associated with being able to be out. Everybody's going to have their own assessment of that risk. They're going to do their own risk calculations. And it sounds like all of you are trying to do the best you can to get the facts out there so that people can make these decisions. And Dr. Rush, we'll have you comment to something that seems to be coming up a lot. The mayor's mentioned it. I think Dr. Sanders has mentioned it, and certainly in her writings, if not on this show. I'd like to hear from you, too. Well, and in fact, you did it in your letter about double bubbling, which I loved, by the way. The the burden of taking responsibility for this is moving less and less from the government and more to the individual, sort of the traditional or stereotypical American way, that tell us what the risks are and we will make the calculations. And you're always going to have outliers that don't behave very well. But I mean, is the future of success really lies with our business owners and with our people, right?
Absolutely. There's suggestions. So everything on the State of Alaska website about moving to stage 3 and 4, they're recommending that people wear masks, and they're recommending that employees wear masks, but they're not absolutely mandating. So, of course, Cordova is a little bit stricter at this point. So they're also suggesting that possibly restaurants keep logs of their patrons. And of course, the reason to do that, which is so helpful if there is, heaven forbid, an outbreak, we would have an easier time tracing who was exposed and be able to bring that under control much faster. Also, with the family units, with expanding your bubble, there's a link on the Department of Health and Social Services that has a little sheet for families to keep logs of who they're in contact with, because right now they're recommending 2 families, but we may be able to expand that even more. And if we're able to expand that, it's so much even more important that individuals take responsibility, not only to who they're in contact with, but the other question is, should they be in contact with them? Because there is a subset of the population that it would be safer for them to continue to not have the expanding of the social contact.
Yeah, those are your seniors, your elders, your people with the pre-existing conditions. I remember that you talked about that, and those more vulnerable folks are also highlighted in the state guidance, that the state is maintaining tighter restrictions around senior facilities, and that anybody who is, say, going to go see grandma or grandpa, and chooses them to be this second bubble that they move into, should weigh that very, very carefully. Because there's potential for serious ramifications. Any final thoughts, Dr. Sanders, maybe to you as we kind of wrap up here? Anything else you want to share with us for this week?
Yeah, I just wanted to add to that, with any kind of public health initiative that we have, we do ultimately rely on public cooperation and support. In New Zealand, we've seen that be very effective with their kind of united response, and they have really battled this illness very well. It's really important for everybody to remember that Cordova has not yet seen coronaviruses. Our immune systems haven't seen this. This is going to be something that when people get it, it is going to be a challenging illness. Our bodies have never seen this before, so our immune system doesn't know how to fight it. So I want everybody to keep very vigilant and be very cautious in their interactions and wearing masks, because this is still a very dangerous illness, even though we're opening up and we really want businesses to be successful. We also want people to be careful.
Yeah. Again, that responsibility returning to the business owners and to the public like it would be, sort of more normally. Again, not to say that coronavirus is the flu, but the response is in terms of knowing that influenza is around. Vulnerable populations need to be particularly careful, and those that are around them need to be particularly careful. But the idea of living with it instead of kind of under its thumb. Some people, I've heard stories too of people, you were talking about logging for contact tracing, that there are some people who are taking responsibility of that for themselves, not out of fear, not out of virtue signaling, but just keeping a log of anybody, an individual keeping a log of anybody that they interact with. So if they get sick, they can know who might have given it to them, or if they, on the flip side, they would be able to determine who they might have come in contact with and possibly passed it on to. So just another interesting idea that people could choose to do if they want. Dr. Rush, what about you? Any final thoughts?
That pretty much summed it up. It is exciting time, and it is a time where we also want to continue to be vigilant. I know everyone's tired of isolating in, but this is a time, as Dr. Sanders said, that is crucial to make sure that we don't have something like a super spreader event here in Cordova.
All right. Well, nobody wants that. And I thank you both very much for all the hard work that you're doing. I mean, yeah, it's part of your job, but on the other hand, you know, when somebody said, "What are you going to be doing in 5 years, doctor?" This is probably not what you were thinking. So thanks for digging in. And I mean, the doctors and the nurses especially are the soldiers in this battle. So thank you so much for being willing to take that on and to spend some time with us today.
Thank you.
Thank you.
Okay, that was an enjoyable conversation. Hope it was beneficial to you. You know, when you do a show, if you're the host of a show like this, you have to digest a lot of information and do your best to speculate on what it all means. And, you know, we're doing our best with that. But when you can hear things directly from the experts, that's a big bonus. And thanks again to Dr. Sanders and Dr. Rush, both for joining together and providing us that information on today's town meeting. By the way, as always, if you missed any of the show up to now, it will be available soon on our YouTube channel, youtube.com/Cordova TV. So regarding the reopening of the playgrounds, I know that from monitoring online chatter that this is something that families with kids especially are looking forward to and have been anticipating. And we now have an official statement that came from Parks and Rec about that, which says the Cordova Parks and Recreation Department announces the reopening of playgrounds starting June 1st. At the Knoll Palace Children's Memorial Park, they will have hand washing available on site in the Snack Shack bathrooms. At the Mount Echols Playground, they're going to ask folks, though, to please come prepared because hand washing is not currently available on site and there's no indoor public access to the school. So that means you'll want to bring your own hand sanitizer if you want to wipe equipment down, that kind of thing. Again, there is the CDC, as we heard from the doctors, is increasingly less concerned about transfer on surfaces, that people catching it from touching things. That doesn't mean there's a 0% chance of that happening. But still, if you want to wipe things down and be cautious, at the Mount Echols Playground, well, really at both of these playgrounds, you would need to take that upon yourself. But hand washing is available at the Knoll Palace Park. And they emphasized, by the way, in a previous version of this announcement, that you should consider use of the playgrounds at your own risk, the same way that, you know, if you go to a pool and there's no lifeguard. I mean, certainly parents can take their kids to a pool when a lifeguard isn't present, but they've got to watch the kids because they're 100% responsible. And, you know, that's how playgrounds generally are anyway. But specifically as it concerns COVID contamination possibilities, it's very much an at-your-own-risk thing, and avoiding any contamination or positive cases is, again, on the individuals and on the families. Now, this announcement from Parks and Rec goes on to say, in the opening of the playgrounds, we need your help to keep them safe. First of all, wash your hands prior to and after visiting the playground. Come prepared by bringing hand sanitizer and or hand wipes. Please stay home if you or a household member is sick. This has been a real important part of this thing all along, is people that are symptomatic should be like uber quarantined. If you're sick, if you have symptoms, just don't go out at all. and especially to the playgrounds, which are going to be high-touch areas. And that would be for the restaurants and the businesses and everything. That's been the guidance from at the federal, state, and local level, that if you're sick, please stay home. Practice social distancing. Play closely with members of your household or your social bubble or your expanded bubble, however that's working. Remember, the double bubble thing is underway. But social distancing is critical. And keep 6 feet of distance with those not in your household or slightly expanded bubble there. Now, they also say, please note, access to playgrounds may be limited or restricted without notice based on future health risks or scenarios in the city. Meaning, of course, that if there was an outbreak or something, they may have to shut everything back down. And that goes for business operations and in anything that where the standards have been relaxed as society gets more used to this virus being around. There's always the possibility that if there's an outbreak that things will have to close back down again, which gets back again to what the doctors were saying, is that we're in the driver's seat, we being the people and the business owners and the non-governmental operatives. The governments at multiple levels are recognizing that people would like to have their lives back, at least in some form. And they, most of them are moving in that direction, certainly in Alaska, are moving in that direction, but emphasizing the obvious truth that preventing or avoiding a community event is on us with social distancing, hand washing, masks, etc. So again, having playgrounds back, certainly good news. That's going to put a smile on some faces, no doubt. But remember, we're still in a pandemic, and we want to enjoy those things wisely and safely. So with that, we will bring this Friday edition of Town Meeting to a close. May 29th. Again, the show, if you want to share it with someone or hear it again, or if you missed the beginning and want to hear it from the beginning, it will be on our YouTube channel soon after completion on the radio, youtube.com/Cordova TV. We certainly hope everybody has a good weekend in store, particularly one that now includes playgrounds again. A big thanks, as always, to Cordova Wireless Communications, your local cell phone and wireless data provider, which provides your local talk show here on KLAM. Daily briefings will be coming up on the radio in the 1 p.m., 5 p.m., and 8 p.m. hours. Those will also go to youtube.com/Cordova TV. And while we don't do daily briefings as a regular practice on weekends, if anything serious should happen, we obviously will jump right in regardless of what day it is or what time it is and tell you what's going on. As you probably know by now, any of the programming that we owe you in the 10 a.m. hour will be forthcoming, and we are very glad, again, that you decided to join us for the Town Meeting Talk Show here on KLAM.